Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. Today we're going to talk about a very important subject. Not so much a disease itself, but how maybe to prevent a disease or how to take care of it if it does affect you. Oftentimes, we think we'll never get anything. We go from day to day feeling good, and all of a sudden something turns in our system some way or the other, and we have symptoms of things and so forth. And oftentimes symptoms are the latter part of a disease, because you can have a disease or a dis-ease of your body, forming different things in your body, tumors or things like this, and you never know you had it until you get symptoms. Well, there's ways we're doing today to prevention. Prevention is the number one game in a sense, but even if we do find something, if it's early enough, it's curable. And so therefore we have all kinds of machinery and hormone testing and different drug testing that we can do on the body itself, and just blood tests, x-rays, MRIs, which are different kind of specialized x-rays and things to pick up things very early. Well, today we're going to be talking about prevention, and also we'll talk about possibly early intervention when we do find something, and speak to a person who has been doing this work for a long time, educating. On radio, television, writings, all kinds of conferences and so forth, and she's what I would call one of the pioneers in really getting the information out. Because a lot of times, they do it very subtly. You don't pay too much attention to it. But when you see what she does and the things she brings forth to your imagination and things like this, it'll make a difference in detecting breast cancer early. And so we're going to be talking a little bit about breast cancer and things like this, and we'll have some information at the end that you might want to get in touch with this person that I have today to come and speak to your group or church groups and things like that will make a difference in the community. So I want to welcome Sarah Marshall.
Thank you, Dr. Deas.
Yes.
It's my pleasure to speak with you once more again.
Right. Well, Sarah, first of all, we've known each other for a long time, and I've seen you around the hospital, and I've seen you at the conferences and things like this. But before we even get into the subject matter today, just a little bit about your background, just what drew you into prevention, and your background in nursing, and a couple of other things that qualifies you to be a specialist in this field.
Oh, thank you. That's very easy. What brought me really, what inspired me in terms of breast health, I'll start first, is when I was a teenager,
right, and
I graduated from high school, I was interested in going into nursing.
Okay.
And I started college, at Queens College, as a matter of fact. And during my first semester, I developed a lump. And at that time, cancer was something that you didn't talk about.
Right.
So, and it was thought that if you lived for 5 years, that maybe there was hope. So what I did during that particular time, I became interested in educating others because of the experience that I encountered during my experience with the lump.
And how old were you at that time?
17.
17.
Yes.
And what made you feel it? Just by examination, or did it hurt or pain?
I just felt a lump.
You felt a lump.
In my breast, doing
bathing and things
bathing,
like this.
Because during that time I don't remember if I was actually performing breast self-examination,
right,
but I found the lump. And I called it to the attention of my guardians at the time. And we had the lump removed.
I see.
And it was non-cancerous.
Right.
But of course I lived to die for 5 years. And it altered my education. So instead of me going on to become a registered professional nurse, I then went to become a licensed practical nurse, because I knew I would not live long enough to practice as a registered professional nurse.
Right.
And after 5 years, then I immediately went back and got my registered professional nursing licensure.
Yeah.
And
where did you study your nursing at?
Well, I didn't go back to Queens College, of
Right.
course, but I went to Queensboro Community College, which was Bayside, for my
Right. Yeah, sure.
associate. and then I went to Medgar Evers College for my BSN.
I see.
And then I went to Malloy years after for my master's in nursing administration and informatics. So I have 2 masters.
So you went through a whole lot of different tricks.
But it was a delay
Yeah.
because of the breast.
But you know, it's amazing how things do change your path in life, you know, and beneficially, not to yourself almost, but to so many other people, because what has taken place in you having that way, you met so many people along the way, even to wind up here at Downstate Medical Center. How long have you been at Downstate Medical Center?
I've been at Downstate since I graduated with my associate degree, which was 75. So in that case, I'm kind of dating my age.
No, you don't look more than 35. I mean, gray hair.
But I'm grateful. I'm grateful.
That's right.
It's wisdom.
That's right.
Yes.
So you've been here a number of years here at Downstate.
Yes.
Doing this type of work. But it's not only in our breast, I understand. It's in so many other fields that you get yourself involved in. But the breast thing is so needed, and people who know what they're talking about, know what they're doing. You know, I think that this is a time of for Downstate to pin you up on their mantle for doing great things, which you have received an award recently. What's that award?
Yes, but before you go to that, I'd just like to give credit to one of the people who, like yourself, was very instrumental in my advancing in terms of the breast health education, and that's Miss Casapo. She was then director of, it wasn't called the Center for Community Health Promotion and Wellness, but it was the outreach education. And I used to do outreach education in breast health, but I was working full time as a staff nurse doing other things. And because of her recognition and the need for me to go out into the community, she then contacted my supervisor, and I was allowed to go out into the community to do breast health education programs.
Well, you know, every time I see you coming down the hall, you don't just come empty-handed. I always see you pulling some kind of bag behind you. So I know in that bag are a whole lot of stuff that you're going to give out to people, set up somewhere, and do something for somebody in their churches. Do you get much chance to get outside of Downstate from the standpoint of your getting information out to the community?
Oh yes, aside from your television shows and the community, once a year and periodically for different organizations, I do breast health education with the mayor of the town in which I reside. I also participate in programs held by the senators and the assembly people in my area, and also even in Downstate, I get invitations to not just Brooklyn Borough, but Manhattan, the Bronx, and beyond.
Well, you know, I was also learning of your background a long time ago, because you've been an advocate worker in the Rotary Club. You know, and that in itself, you've done a lot of work with the Rotarians and a lot of the other outside organizations that you belong to. It's not just Downstate you're teaching in. That's what I'm trying to bring out, making you say something about that.
Okay, with the Rotary, there again, I did the breast health education and with all the civic and the organizations. But I worked with the Kiwanis Club in terms of, they had a worldwide service project, iodine deficiency disorders, of which, again, I'm a survivor.
Yes.
So therefore, when they use that as their worldwide service project in conjunction with or in collaboration with UNICEF, I was asked to be their coordinator for the District of New York. And I was allowed, that facilitated or that allowed me to go internationally to do presentation on iodine deficiency disorders. And I was also able to raise thousands of dollars. And we were also able to eliminate iodine deficiency disorders worldwide, which was worldwide at the time. And now they're just following up in terms of maintenance and prevention.
Right.
So we saved a lot of lives.
Oh,
that way.
listen, I know you have. You know, and presenting your material, as we see right here, as you laid out a lot of the beautiful things that takes away the drudgery of having a condition. Right away, you're enlightened by the colors. You're enlightened by the just a simple thing of a petal. You know, that's, to me, that's very sensitive and as such. But all the other things that you have developed or participate in, for example, this bracelet here that I have one on right now. What does that bracelet mean if you're wearing it around? Or what were you trying to do with the bracelet?
Oh, we're trying to publicize breast health, and some of the bracelets may say hope, some of them may say courage, some may say faith, and some may say love. While they all paint, but they all have different saying that represent breast health.
Right, and that's a wonderful way of presenting a subject, because it is not only decorative, but it gives a message of people say, well, what's that you're wearing on your wrist? You know, and then of course the pink comes out and things like that with these different words like hope, courage, care, and so forth, and support. Well, that's wonderful, because these can raise a lot of money.
Well, it does help to raise money, but also in terms of the bracelet,
Yes.
we like to think of it as making a donation.
Okay.
And this is just like a token of appreciation and also a remembrance, so that you can remember to wear this.
Yes, that's wonderful. Now tell me, Aaron, in prevention, you get into prevention also in your duties as a teacher and so forth. Are there certain things, even before prevention, breast examination?
Breast self-examination?
Yes, self-examination.
Okay.
The importance of doing that.
Well, it's very important that, I would say it's very important that you perform breast self-examination, although the American Cancer Society, which is one of the organizations and the oldest organization that does the screening,
Right.
but they said it's optional as of 2003, but I still say that you should perform breast self-examination monthly.
Right.
Because of the fact that many of the changes are found by women themselves, just as I mentioned that the change I found, and I wasn't really within that age specific.
Right.
So according to the American Cancer Society guidelines, they said between the ages of 20 and 40 that you should perform a clinical exam every 3 years,
Okay.
and that breast self-examination is optional.
I see.
But if you want to perform breast self-examination, then your healthcare provider should then make certain that they monitor you periodically to make sure that you're performing it correctly.
Yes, right.
Because you can perform breast self-examination and not perform it correctly.
Right. Now, I don't know if it's hard to demonstrate that here, of course, but just in the movement of body, as you would examine your breast in front of a mirror or something like that, what would be an idea that you could, woman getting out of a shower and there's mirrors in the bathroom or anything like that, what's an easy way they could examine their
Well, one of the ways that you would examine your breast we don't recommend you examine your breast in the shower anymore.
Right, okay.
Because of quality issues or safety.
Right,
You could
okay.
slip.
Right.
So when you dry yourself off and you come into, or while you're in the bathroom
Right.
or in your room,
Right.
you would then look in the mirror. You would examine your breast with your hands at your side. And when you're looking at your breast, you're looking to see if both breasts are equal,
Right.
or if there is any changes in terms of if there are any, like some people have dimples in their cheeks,
Right, surely.
if there's any dimpling, or if the breast tissue itself looks like an orange peel,
Right, yes.
or if both breasts are equal, mindful that one breast may be larger than the other.
Right,
But
sure.
that's why you want to be familiar with your breast, so you will be able to notice if there's a change.
Right.
So,
surely.
and if there is a difference, if you were looking at your breast monthly, then you will be able to notice if there are any difference.
Surely.
So then you would look in the mirror. you will look with your hands at your side, and then you will look to see if there's any changes in the breast.
Right, I see.
Then you would turn to both your right and your left side, still looking to see if there are any changes, because you can see from the side and you can see from the front.
Side. Yeah, oh yes,
exactly.
Surely.
And then when you finish with your hands at your side, then the next thing you want to do is, as you examine your breast, you want to raise your hands over your head. And while you're raising your hands, you're still looking in the mirror, and you're looking to see that both breasts raised equally. Or if one breast is tucking behind, or then again you see the dimples, then you know that there's a change.
Right, surely.
Now, also, sometimes one breast is turned inward, the nipple, which is called inverted. So if that's your breast, then you would know that that's normal for you.
Right.
But if normally your breast doesn't turn inward, then you then notice it turn inward, then you would know that there's a change in your breast.
I see.
And in that position with your hands raised, you would also look straight in the mirror, and then you would look to your right and you look to your left. And then the third position, you would put your hands on your hips, and then you would lean forward, because when you notice changes, it's not always a lump, but it could be a thickening.
Okay.
So as you lean forward, you could see in your chest if there are any thickening or swelling or lumps there that would rise. And then in that position, you would turn to your right and you would turn to your left. So those would be the three positions that you would look in the mirror.
Right.
Then when you, and men and women can look in the mirror and do that position, because men and women do get breast cancer.
Yes.
Yes, it does not discriminate there.
Well, I have picked up breast cancer in men by doing a breast examination on them. Generally, sometimes there are certain things that enlarge the breast, like smoking marijuana, for example, that enlarges male's breast, you know. And so right away, sometimes if I see a breast that's enlarged in males, I'll say, "Are you smoking marijuana?" And they'll say, agree that since they've been smoking marijuana, their breast has enlarged, you know. And as you get older, your breast has a tendency, even in males, to sag as such. And if you don't palpate that, you don't really know what's going on.
Well, women from age also do get their breast sag.
Yes,
that's something that's unavoidable.
Right.
So, but in terms of, so men and women would examine their breasts looking in the mirror.
Right.
Now, with women, when they're actually performing the breast self-examination, then they would lie in the bed, put a folded towel under that breast that's being examined.
Oh, I see. Okay.
Yes, and the reason they would put a folded towel rather than a pillow, because they want to even out the breast
talking about
tissue.
A folded towel in the back.
Under the back.
Under
the shoulder, that's the breast that's being examined.
Oh, I see.
It would even out the breast tissue.
I see.
As opposed to when you're in the bed, you know, the bed, as you move down, the bed would move down. So with that folded towel, it would firm out the breast tissue.
So you could really palpate it.
Exactly.
Yeah, right.
And so,
that's interesting too.
Right. So you've observed the breast in the mirror. Now you're going to palpate or feel when you're lying down. So you would then take that, if it's your right breast that you're doing the examination, you would then either take that right hand and cup behind the head,
I see.
or you could angle it outward, or because you mentioned earlier that as we get older, that our breasts have a tendency to sag, or if we have large breasts, we may have to support the breast.
Right.
Then we would take the opposite hand, which would be the left, and the 3 padded fingers, because we don't want to take the tip of the finger, because if we take the tip of the finger, we may be doing indentations.
That's right.
So we want to take the pad of the fingers, and what we want to do is palpate or feel the collarbone, and we want to go from the collarbone to below the breast line, from the chest, sternum, to the underarm, including the axillary and the underarm. And then we want to use the 3 padded fingers, and we want to start, and remember we either have this. So now what we're going to do, we're going to go in 3 different levels. We're going to go light, medium, or firm, because they detect changes in each one of those levels.
I see.
And when we are ready, so we're going to start light, medium, firm. We're going to move down 1 finger breadth and then we're going to repeat that. And we're going to continue to move one finger breath until we've reached the lower part. And then we're going to move over one finger breath. Then we're going to come back doing the same thing and move over until we've examined the entire breast. And when we finish one breast, we're going to then repeat the examination on the opposite breast.
And how often should you do that examination? Is that every day, every week, every month?
No, it's once a month.
Okay.
So let's just say if you get your menstrual period, you should examine your breast 7 to 10 days from the first day of your menstrual period. So you're going to count the first day and up to 7 to 10 days. Then you're going to perform the breast self-examination.
I see.
If you don't get your menstrual period, and for men, teenagers, or for whatever reason, then you would select your birthday.
I see.
Many people say, well, I want to use my red day, but you may forget that. But one thing that everyone remember is their birthday.
Right.
So on their birthday, they would examine their breast every month.
I see.
So when I say your birthday, like your birthday would come on the 6th of the month or the 10th. But if your birthday comes on, say, the 29th of February, well, you'd only get a birthday every leap year.
Right, sure.
So in that case, you would examine your breast on the 1st of the month when it's not a birthday.
I see.
And you would examine your breast each month. And again, the reason you want to examine your breast each month at the same time, because the body changes from week to day
That's right,
with
surely.
different hormone level.
That's
but if you're
right,
examining it at the same time each month, you're getting basically the same.
Well, I think that's good information, because a lot of women, I don't think doctors take enough time. I'm talking about not the the doctors who take care of female patients only, but just general doctors don't give their patient that option to how to examine their breast and when to examine their breast. And the changes of the body makes the breast either swell or reduce in size and things like that. So you can tell month to month how things are going on.
Because that's why you want to examine your breast 7 to 10 days from the first day of your menstrual period.
I see.
Because during your menstrual period, your breast may get lumpy.
Yes, you're right.
And and that would be because of the menstrual period. But 7 to 10 days after that time, they're not as lumpy because it would have slushed off in your menstruation.
And there's other things that you have to consider too. A diet can make the breast change. For example, people who drink a lot of coffee with caffeine. Caffeine and lumpy breasts go together.
Yes. So they're not definitively certain about that.
Right.
But there were some studies where they find that the caffeine, and caffeine we know does,
especially
make
if
a
you
lot of
have
difference.
cystic breasts.
Yes.
They find that the cysts enlarge with caffeine, or at least they think it does.
It does.
Yeah, right. So with the Starbucks and all these coffee houses now, a lot of people are drinking coffee. Young people, even before years ago, as a teenager, you just didn't drink coffee in the house. It was a no. Your father might drink it, your mother might drink it, but in certain areas, though, like in Hispanic or Puerto Rican people, they drink a lot of coffee. And I think the teenagers drink more coffee because they mix it with a milk base. And it's a very tasty drink, those lattes so-called, in a sense. But you're still putting something in your body that can enlarge that breast and things like this. What do you think about the future? Has the incidence of breast cancer increased?
Well, because of the screening of the mammogram,
Yes.
there's a decrease, at least documented according to the facts and figures through the American Cancer Society.
Right.
And it has been steadily decreasing since '98.
Oh, okay.
Yes, so up until we have some definitive documentation as of 2008, and they find that about 7%.
I see.
So mammogram screening and has reduced a lot.
Sarah, it's a pleasure having you here.
Thank you for having me, Dr. Deas.
And the magnificent display here of all the information that you hand out at the places that you go and do. And to you folks out there, it's extremely important that these kind of shows coming out of Downstate Medical Center really help to improve your health and prevent a lot of things because of the expertise we have here, such as Sarah Marshall, who's one of the champions here for prevention, going around talking at churches and community organizations and having a clinic right here oftentimes. So you might want to look at the number that you might see on your screen, that you could get in touch with her to get some more information on what they're doing here at Downstate Medical Center. But cancer of the breast shouldn't be a frightening thing, but it is curable if you catch it in time. And if you go to good institutions where they have this kind of information available, it will make a difference in your life. Just think of Sarah at the early age finding a lump there and finding that it was something that was not malignant, but she's living today. So we'll see you next time on our next show on breast health and unhealthiness of the breast. See you next time.